Even with health insurance, many people experience high medical bills and medical debt, sometimes even for bills they shouldn't owe. In this video, we'll cover 5 steps you can take now to avoid high medical bills. Let's get started. First, enroll in Medicare on time. If you delay enrolling in Medicare, you could face expensive and lifetime late enrollment penalties, as well as gaps in coverage. You should likely enroll in one of 2 enrollment periods. Your initial enrollment period, also called your IEP, is the 7 months surrounding the month of your 65th birthday month. You may also be able to delay enrolling in Medicare and use a special enrollment period, or SEP, if you or your spouse are actively working and you are covered by group health coverage related to that employment. Second, see the right kind of providers. If you have Original Medicare, you should have the lowest costs when seeing participating providers, which means they accept Medicare and accept Medicare's approved amount for a healthcare service as full payment for that service. Non-participating providers accept Medicare but can charge you more for services, and opt-out providers don't accept Medicare at all. You should be sure to ask your provider if they are participating, non-participating, or opt-out. Cost-sharing and provider types are different for those enrolled in a Medicare Advantage plan. Each plan has different network rules, but costs are typically lowest when you use in-network providers and facilities. Contact your plan for more information. Third, choose the best prescription drug plan for you. You can use Medicare's Plan Finder tool to compare Part D plans. Medicare Plan Finder is an online tool at www.medicare.gov/plan-compare that can be used to compare standalone Part D plans or Medicare Advantage plans. In Plan Finder, enter the drugs you take and the pharmacies you use. Plan Finder will then display results for plans in your area, listing those with lowest costs for you first. You can select each plan's details to find out more specifics, including any coverage restrictions that might apply to your drugs. Fourth, get screened for cost assistance programs. State and federal programs can help lower your costs if you have limited income and assets. Such programs include the Medicare Savings Program, Extra Help, state pharmaceutical assistance programs, and Medicaid. You can contact your state health insurance assistance program, or SHIP, to be screened for cost assistance programs like these. Find your local SHIP at www.shiphelp.org. Finally, check your Medicare statements for billing errors. Looking for billing mistakes can prevent you from erroneous denials or paying for costs that should be covered. These statements might be mailed to you or sent electronically. You should read these statements carefully, making sure that the services listed align with what your provider told you and the service you received. If something in your Medicare statement looks incorrect or suspicious, you should contact your doctor's billing office and get as much information as possible. If there was a mistake in the statement, the billing office should correct it and resubmit it to Medicare. Medical bills and debt can take their toll, impacting your emotional, physical, and financial health. But by arming yourself with this knowledge and taking action, you can limit your chances of paying high or incorrect medical bills.